is sensory processing and sensory integration? Sensory integration is the coming together of all the sensory processes from all parts of the body in the brain in an integrated way in order to make sense of the world. Sensory processes include the 5 senses: body position and movement, balance, gravity, and internal body workings. When integrated, these help the child to act appropriately with motor movements and behaviours in a purposeful way, such as riding a bicycle or regulating their emotions. Sensory processing disorder exists when sensory processes are not organised into appropriate responses, and the child receives confused or imprecise information about his body and the world around him. This results in the brain being unable to direct the behaviour effectively. Dr. Jean Ayres described this as a neurological traffic jam in the brainstem that prevents particular parts of the brain receiving the signals to interpret the sensory information correctly. This can affect a child in a mild to severe way. 1 in 6 children experience sensory symptoms such as motor clumsiness, behavioural problems, speech-language communication difficulties, anxiety, depression, and school failure. Maggie Johnson's model of language, literacy, and sensory disorders shows us the processes for communication, from attention to auditory processing, language and literacy processing, vocabulary, speech, and making sense of the communicative context. Please see my website for more information about this. This model also reveals that whole body sensory processing disorders can co-occur with other disorders, especially ADHD, semantic pragmatic language disorders, auditory processing, dyslexia, dyspraxia, and autistic spectrum disorders. So what does SPD look like? 1 or multiple senses may be affected. A child may be over-responsive to stimuli, under-responsive, or a combination of both. If motor skills are affected, the child may be a floppy baby, then later a clumsy child. A child may be a sensory seeker. He likes louder, faster, brighter sensations, or a sensory avoider. SPD produces behaviours that occur with frequency, intensity, and duration that are not in line with the child's developmental level, and it's unique to each child. SPD can be variable across time. A child may have poor concentration, poor emotional regulation. They may shut down, explode, or cry, be fussy and controlling. They may have low energy levels. They might have high anxiety levels, which affects communication. He may be a poor or reluctant communicator. He may have selective mutism. Problems with auditory processing can affect language processing and the ability to hear sounds in words and words in sentences. A child may appear clumsy, uncooperative, belligerent, disruptive, or out of control. These children are often misunderstood in school and regarded as having purely behavioural problems. An SPD child is at risk for emotional, social, and educational problems due to their motor difficulties, social communication difficulties, low self-esteem, anxiety, depression, and aggression. It can persist into adulthood and affects one's ability to succeed in marriage, work, and social environments. So how is it treated? It varies according to the child's level of need. Many have average to above average intelligence. Their brains are wired differently, and they need to be taught in ways that they process information and to do activities that challenge them. An initial assessment is required and done by sensory integration therapists, usually an occupational therapist, and with myself at a joint clinic. Strategies for home and school are put in place and followed through in the speech and language therapy session. Sensory circuits that we do aim to develop appropriate responses to sensations in an active, meaningful, and fun way so that the child behaves in a more functional manner. This will generalise across home, school, and social settings. The first phase is called alerting. This is to provide vestibular stimulation, preparing the brain's availability for learning, and can include jumping on the trampette, bouncing on a gym ball, skipping, and jumping jacks. The second phase is the organising section. It includes activities for multisensory processing and balance. The child needs to organise their body, plan their approach, and do more than one thing at a time in a sequence. This can include balancing, remembering a hand and number, repeating a sentence, and knocking over a skittle. The calming section comes last. It provides deep pressure, especially through squashing, and ensures that the child leaves the circuit in a state of calm, ready to learn. The listening program is also used to work on sensory processing and calming. Sensory processing and integration improves in children who have done these activities with speech and language therapy. There is remarkable improvement in attention, speech, language, communication skills, listening, and literacy skills.